So just to introduce who we are, we're Hamlets. We're 3 agencies IAT project. So we have East London NHS Foundation Trust, the local authority, the local borough of Hamlets, and Docklands Outreach, third sector organisation. So we have the challenge in terms of organisational transformation of working within 3 very, very different organisational cultures. We work in the East End. We have a multicultural population in the East End, and I think IAT's been tremendously helpful to us in that I think it's given us a renewed sensitivity to the needs of the multi-ethnic population, and also in terms of improving access to psychological therapies. I think it's been really important to think about how local families and young people perceive of where they happen to be within the borough. So whether they're in Brick Lane and E1 and E3, whether people live in E14 and on the island, I think we've learned much more about where people are prepared to travel or to go into new areas or different postcodes to receive psychological therapies. So I think that we've been enhanced in terms of sensitivity to the particular needs of the various communities that live within the borough. I mean, one of the things, and I think other speakers have alluded to this, is the immense pressure on the NHS trusts, local authorities and the voluntary sector at this particular moment of redesign, financial pressures and so on. So I think it's been a test to keep focused and to think about ensuring that children and young people do have improved access to the best possible psychological therapies in a way that feels particularly relevant and meaningful to our own particular population in Tower Hamlets. So I was sort of asking people, generally we've got the 5 trainees, we've got the 3 supervisors, and 2 of us, the general manager and myself, participated in the leadership training. And I asked us a sort of a survey about quick gains. And I think the quick gains are measuring outcomes and eliciting, sensitive service user feedback. Also, the key idea I think IACT offers is it provides a service design. I think when services are being constantly reconfigured and funding is challenged, and our partnership might be thinking about what does the service need to look like, I think it's really fortuitous to have IACT come along at the moment that we became part of IACT in that we can say this is a service design, client-centred, evidence oriented and therapeutic outcome oriented, although we also have all of the challenges that other people have spoken about. So therapies, evidence-based, outcome tools overviews, providing feedback to the clinicians. We've been collecting court measures for about a decade. We hadn't really got into that reflexivity of feedback, so they became an administrative, separate, non-clinical sort of task. So we've been using the IAP culture to try to think about how we can better give feedback to service users, to clinicians, and also to commissioners and different agencies. The quick gaze was also role play and video, using video as a clinical tool as being immensely useful. And we've also thought about other ways using video as part of role play in terms of management, supervision, and so on, much more broadly and widely. Simple things like the do's and don'ts outcome monitoring chart was tremendously useful. All the clinicians enjoyed this. It felt very, don't use a questionnaire if it isn't meaningful. And so those lists, those monitoring charts have been really, really helpful because they're very, very clear. So I was thinking about the IAP principles and, about collaboration and teamwork. So there's the idea that we were all in this together as an IAP board with the 3 agencies, the local authority, voluntary sector and us. We all thought somehow we were going in the same direction. But of course, the different agencies have different drivers, different financial pressures, different cultures. So I think collaboration is definitely the big learning curve and the principles that we want to adhere to mostly. Measuring feedback, I've talked about. Engagement and sustainability, both in terms of our various communities and the different psychological therapy needs of the community, but also in terms of the bilingual co-working, and that we brought into the parenting, the IAPT early years parenting groups, 3 interpreters in each of our parenting groups, massively good, high attendance, better than any other parenting groups in Hamlets. Our parenting trainees have succeeded in this way. So this is again the way in saying, are we meeting some of the needs effectively for our clientele, are we not meeting the needs? So, okay, so the IAP board, as I say, we met monthly for a year. We continued to meet. That's been a challenge because of all the competitive interagency environment of an economic, recession. So the idea of shared power, both in the room with the clients, in the managerial work, supervising staff, but also in the interagency power sharing. So there's been grappling and, whose agenda is this, whose isn't. So we've been trying to look at going forward. And I think the IAP principles are really useful almost as a checklist, like a kind of organisational MOT to say, where are we in regard to service transformation? Where are we in terms of evidence-based practice? Where might we be in terms of engagement and accessibility? So I think those are good guiding principles. In the spirit of collaboration, I asked a local authority partner to send me a couple of slides, and I was quite heartened with our partners where they include that commitment to the community and to say, listen, we need to build on these principles. We also need to influence the commissioners. The commissioners are very on board. The local authority is the lead commissioner for Town and Cans. Also, the CCG commissioner is very on board and interested. And also, in terms of, I think other people have mentioned this, how do we now, the IAP, immediate money and backfill for the 5 trainees and the supervisors as stocked for this year, how do we continue to, in their job plans, make sure they've got time to continue rolling out the parenting programs for the parenting trainees, rolling out the CBT for all of the young people who've been receiving CBT. The promising news is we've got further trainees on the family therapy training and the interpersonal psychotherapy training we're working in the direction of. So it means this refuels the whole service transformation and organisational transformation in Hamlets CAMS. Also, there's a big conference because the local authority are looking at troubled families. They're looking at cuts of, maybe even a third in the local. So to have us on the agenda for a major conference on troubled families, which is a conference about redesigning the whole of the local authority mental health services throughout Hamlets, is some level of commitment that we've got from our local authority commissioners and partners in IAPT. From Docklands Outreach, the voluntary sector, one of the parenting trainee will be going forward. We managed for us, who's here today, to make sure that there was backing for the continuation of her post. And what was very persuasive, of course, is the Incredible Youth Parenting Programme that she ran with a local authority IAP trainee. Full attendance, no dropouts. That doesn't happen in any of the parenting programs in Taham. It's a very, sort of chaotic families, very troubled community, many adverse mental health risk factors in Taham's community. So that she will continue in terms of the measures. Debbie and I, the supervisor for the CBT, we've been rolling out a whole program on the measures. RCADs are now part of every new case file, as is SDQ, and we're looking at session by session outcome measuring. I don't want to portray it as all good because clearly it's very hard, we're very pressured staff, we're very busy, our programs are becoming, my own program, everyone's diary is fuller and fuller the whole time, but we're trying to incorporate, we've gone electronic on Rio, that these electronic measures will be part of, rather than IAPT is an additional add-on burden. It's actually integral to absolutely every case we see. That message isn't always understood by directors, it's not always understood by the trust board, but that's our commitment. And the idea of why do something different, and we're actually kind of saying this is what the programme brings and these are all the gains. So we've learned a great deal about attention to context. The context for the children, families and young people, the population demographic, very, very young and growing underprivileged population in Hamlets. the early years being from age 3. We've run workshops, 70 people from all the professions working with under 5s came to the workshop. That's now being sent to adult social care and also adult mental health. So the Trust and local authority are backing people to come and join these sorts of interventions and programs. I know I'm probably at the very end. So to end on a movie quote, I out money and local authority money. We've now commissioned a director, film director, proper professional film director and a manager, and they're meeting with us and they're going to make a film about IAT, you know, and I hope that everyone at our table at Hamlets will be part of that film. The trainees are being interviewed by the director and the supervisors, and we're going to launch that film. I know it sounds odd a year on that we talk about launching IAT, but it does feel a bit like that into Hamlets. And we're going to, at a conference for troubled families, spend the lunchtime opportunity to play the film that you know IAT is largely paying for. So the message I felt is life's all about moments of impact. You know, the children and the young people and parents are feeding this back to us and how they might change our lives forever. So for those children and those young people that have benefited, not just for now, but of course the long-term evidence, research-based outcomes can be demonstrated in the community and to the commissioners and stakeholders. That's the entire Hamlets presentation.